My involvement with ScotCap started when, as Chief Operating Officer of the Digital Health and Care Innovation Centre, we funded the HiCap project to conduct an early evaluation of CCE in Scotland. At the point in 2018 when CCE was being considered for national adoption, I had returned to NSS and we recommended an innovation partnership procurement approach to achieving the goal of national widespread adoption and the realisation of the expected benefits. This begin with the end in mind mindset has been at the core of our work from the outset. The innovation partnership approach allowed us to work with NHS, academic and industry partners from early discovery work through to evaluation and on to implementation and adoption in a single procurement process. This was the first time that this process had been undertaken by the public sector in Scotland. So whilst we were breaking new ground in terms of colon cancer diagnosis, we were also doing the same in terms of our innovation practices, with all of the partners working together to co-design, co-produce and co-deliver the emerging solution, a CCE managed service for Scotland. We took a phased approach to achieving our end goal, with the outputs of each stage informing the following stage. Evidence gathered through HiCap and the early discovery work informed the evaluation phase, and in turn the evaluation evidence, along with health economic analysis conducted by the SHTG team in Healthcare Improvement Scotland, was critical to informing the business or value case. This was a pioneering piece of work which established many of the building blocks and approaches that underpin the ANYA framework. We had completed our evaluation and drafted our business case by March 2020, when COVID-19 pandemic landed. As an aerosol generating procedure, we immediately saw the opportunity for this valuable managed service to play its part in sustaining critical cancer diagnostic capability during this time of crisis. We engaged clinicians, service delivery teams and government with the proposition, and by June 2020 we had approval to proceed and we were able to mobilise immediately due to our earlier preparedness. From the outset we had recognised that successful adoption would be born from a considered change management approach rather than assuming the service would be picked up and adopted out of the box. There were complexities around how this fitted within the overall pathway, how we would handle patient referral, appointments, delivery of the service to patients, return of the recording belt, recording and reporting of management information, and the handshake between the managed service provider and each health board. All of this had to be understood and localised with each health board team through joint working and engagement. And this work continues today with the few remaining health boards still in the process of adoption. As we engage with and listen to the health board and patient experience, we have continued to work together to improve and refine the service as a partnership. Also, as we have gathered more data and knowledge through this experience, the value case has now been revisited to ensure a sustainable future for the CCE managed service as part of the NHS Scotland Recovery Plan. Thank you.